Some chemo drugs are irritants, okay? They're irritants. If you have a drug, we call those vesicant drugs, it's like battery acid. If they're on your skin or exposed to a vessel that's especially superficial, it can eat through it and start to destroy this area. If you have an area that's red, that's swollen, that's showing any of this, you want to stop this transfusion immediately, okay, or infusion, I should say. Stop the infusion immediately because it can cause destruction just like this of the arm or of the skin. So this is what, if you poured acid on, you would expect. That's how harsh some of these chemotherapy drugs are. It's called extravasation, okay? So it can be very harsh. So please stop the infiltration or the infusion immediately. So what are you going to look for? You're going to look for skin that's painful, swollen, red. Okay, here's a little child's hand that had the same thing. So any types of signs, you want to stop that immediately to cause less damage. Radiation therapy. Okay, so we had surgery, we had chemotherapy. Radiation is another therapy that is often used for treatment of cancer. Okay, should be termed energy therapy because it's using concentrated beams of energy to destroy, to break up some of those tumor cells that we have. It helps to stop the replication of cells, so it can at least slow it down. Now, the dose of radiation is going to be based on the tumor size and the tumor volume or the type of tumor. Okay. The doses of radiation is going to be all varied to those spots. Now, one downfall of radiation is it can really only hit a couple of spots. If we have tumors throughout our body, it's hard. Here you can see on this x-ray, there's multiple tumors throughout this person's pelvis. So it can't hit all of those places at once. So radiation is good on specific tumors, but if it's throughout the body, it's a little hard to treat the patient with radiation. It can be ineffective. Now, before a patient undergoes radiation, oftentimes they're marked. We call it tattooed, okay? They'll become tattooed or marked so that they can set the rays precisely every time. So you might see people. This step is known as simulation, okay? Setting the exact tubes of where the energy beams or radiation is going to be headed to. Now, treatment with radiation can be used for multiple reasons. Again, just like the surgery, multiple reasons it can be used. It can be used as the primary treatment. This is what we're going to be used. It can also use in conjunction with chemotherapy. The chemo works good. Two different ways it'll work better. It can be used after surgery, okay? Trying to shrink the cells or get the cells from not proliferating after we remove some. Can be used prophylactically, hopefully preventing something for disease control and for palliation, just helping with some of the pain. Radiation can be internal, okay? It can be internal, it can be external, okay? Or going on here, you can see all the different reasons why we would use our radiation, and last would be palliation. So radiation can be internal or external. I showed you a picture earlier of external radiation. This would be a picture of internal, where we have implanted seeds of radiation in this patient's pelvic area through here. This is probably a prostate cancer through here. What are some things we need to remember? Well, first of all, now the patient's going to be radioactive, okay? So you're going to need to protect yourself as a nurse. You're also going to need to educate the patient's family that you need to be careful with this patient. The patient is actually radiating, okay? So you need to watch it. Look, as a nurse, make sure the patients look for isolation or signs for isolation. Think of how the patient's going to feel when they're so distant from their family and from nursing staff. So there are considerations. Now, when we have different treatments, either radiation or chemotherapy, unfortunately, it does a lot of good, but there are side effects with it. Some side effects that you might see, let me go through the body system. First of all is in the GI system. You might see some stomatitis, some zomatitis with an X, okay? I'm terrible at pronouncing these words. But anyway, it's inflammation or obstruction or ulceration inside the mouth, okay, like canker sores, cell destruction. It can be very disruptive, hard to eat, hard to swallow. Imagine having a canker sore and then multiplying it by 1,000. That's how some of our patients with chemo and radiation therapy can feel. They might have a lot of nausea. If they're having a lot of nausea, treat them beforehand, okay? Treat them with some of their anti-nausea before their therapies. That might help. They might be very anorexic. They don't want to eat. Food tastes and smells terrible to them. Give them something they like to eat. Don't give them something they hate, okay? So if I ever have chemotherapy, don't give me liver, okay? I still won't eat it. So make sure you give them something they like to eat. They might have diarrhea, they might have constipation, they might have also increased hepatotoxicity, okay? Remember, these drugs are like any other drug or any other medication in the body. It has to go through the metabolize. So it's going to be metabolized in the liver or broken down in the liver. If these drugs are caustic to our body, imagine what they're doing to some of our internal organs. So we look for hepatotoxicity with some of these medications. Cancer patients often experience decreased fat levels. They're going to start losing weight. They're not getting the calories. So give them calories that are higher in fat, higher in protein to help with this, okay? Another thing you might see in the blood system, you're going to have depression of the bone marrow, so you're going to see depletion of white blood cells, you're going to see depletion of red blood cells, you're going to see depletion of platelets. So all the things that go with that. Chances of hypoxic conditions, so oxygen issues you're going to be watching for, infectious issues you're going to be watching for, bleeding issues because of the lack of platelets. So all of those things. In the skin, you're going to see alopecia. Hair is a rapidly dividing cell, so it's going to the chemotherapy is going to be working on hopefully the tumor cells, but it's going to be hitting a lot of the other cells themselves, like the hair. So people with chemotherapy or undergoing chemotherapy, a lot of them are going to be losing their hair, called alopecia. Okay, people with radiation might have burns to their skin, like sunburns. Treatment with aloe vera is very effective with them, treating the burns themselves, trying to get that down. They might have increased photosensitivity too. The urinary system, remember the excretion, kidneys might be damaged, nephrotoxicity. Bladder also we need to look at. You might have some cystitis or inflammation in that bladder because of the irritation that you see with the chemotherapy medications in the bladder. The nervous system, they might have some peripheral neuropathies that they might have. They could even have some increases in the intracranial pressure based on the inflammation response and where the radiation or chemotherapy is being targeted to. Respiratory system is not uncommon for the patient to have some pneumonitis, okay, inflammation in that lung area, or pulmonary edema, okay. In the cardiovascular system, same thing. You might have some pericarditis, endocarditis, myocarditis, cardiotoxicity. Just the contact with the medication in that blood system can cause some of these changes. Patients recovering from chemo also have higher instances of gout, okay? We have what's called a tumor lysis syndrome, okay? And that's usually caused by a lot of uric acid, and so they're going to end up with gout. And as you can see in this picture, gout is not always just in the feet. You can see it in any joint in the body. And here it is in the patient's hands. How terribly painful that is. Anxiety, another thing. If you have cancer, imagine what your anxiety level would be. You're worried about yourself. Are you going to make it? Your family, your house, your family, your jobs, all those things. So patients with cancer or undergoing cancer treatment are going to be very anxiety ridden. So are their families. So as a nurse, you're treating the patient, but you're also treating their family. So very important to look at those aspects in your nursing. Fatigue is going to be very common with patients that have cancer or undergoing cancer. Remember anemia. Number one side effect of anemia is fatigue. Well, I'm telling you, with the bone marrow suppression, they're going to have anemia. So expect fatigue. On top of what's happening to their body, they're going to have lots of different aspects that you're going to need to be looking at and helping with as far as treatment.